to Dr. England?
Thank you. I don't have a lot to report. We're just looking at a lot of cases increasing and pressuring our system. I happened to be listening this morning to a prominent national epidemiologist who said that as much as we've been through since March, that only 7% of the population has been infected so far. And that correlates to a need for herd immunity at somewhere around 65%. And that's after all we've been through. So this virus seems to be have the woods on fire, and there's plenty of people left to infect, and a lot of misery. And if you do some calculations on the back of an envelope, you'll see that we could go on like we are now for over a year and just begin to get to the 50% infection rate for the nation. And we're at a point now where the largest hospitals in the state are out of ICU bed space, and we're dealing with a tired group of doctors and nurses here, and no place to send any excess cases, and so we've got them. Just to say that it's going to take an awful lot of change in the way we're behaving and conducting ourselves if we're going to change anything over the next year. The mask requirement has to be observed. You may come to further lockdowns. We know that helps. But if you get to a point where the hospital can't take care of patients anymore, or maybe patients who need oxygen are being sent home, then you've reached your limit. And so it's going to take an awful lot in the way of our adapting to this, more so than we have up to now. So I'll leave it at that. Just a thought.
Dr. England, I have a question.
I have a question. Hold up, William. One of the things that really concerned me, Dr. England, based on what I've been seeing on the news, is that there have been people who've been infected with COVID-19, and there have been cases where some of those same people who were infected have actually been infected again. And what that tells me is that there's an antibody issue that's going on. And according to some scientists out there, of those that have been infected, only about 16% or so producing a sufficient number of antibodies that respond. So, based on that, from a medical standpoint, if a vaccine is ever developed, what does that tell us, Dr. England?
It means that this could go on well past a year if the immunity doesn't carry over for the majority. And the only thing that would change that dynamic is a change in the way we approach each other. And also, if there is a vaccine, and again, I keep saying be pleasantly surprised if there is one in that time, or if we have an improved technology as far as treatment is concerned. So it's all up in the air. I've heard the same studies that you just quoted, and it's unnerving to know that you can go through coronavirus and then 3 months later get it again. So I've got patients who have had it, but they're still masking themselves up. They don't want to deal with it again.
Dr. England,
go ahead, William. William first. Hold up, Bill. William.
Okay, Dr. England, my question is, I'm going to ramble a second, but there's so much unwillingness for a large portion of the public to believe that the statistics are accurate and that the struggle with this virus is a real problem. And I actually hear what you shared with us as a very alarming statement. That is that, and I already knew this, but hearing you say it was frightening. Only 7% at the most of our population nationwide has been exposed, and already in many regions, including ours, in the Jackson Medical Center's hospitals, they are full. Their critical care units are full. If any of us have a need for critical care, hospital care, we're in trouble. And a single-digit percentage of our population has had a positive response to this virus. This is very alarming. And there's no end in sight. How do we get that seriousness conveyed, communicated to our public so that they understand? You know, those of us who take this serious are called alarmists. And I argue we're not alarmists. We're appropriately concerned. How would you, as a healthcare professional, suggest we deliver this message to the public? And I have a suggestion. Everyone places profound and due respect on the statements of a person who has MD behind their name. And the early messages from you and Dr. Meir had a profound and impactful benefit to our community. How can we perhaps get these knowledgeable messages to our community that we are not alarmists, that we have a serious crisis on our hands, and that people need to pay attention?
I hope it's enough that from what I just said, that unless we are very strict about the masking, that's our only hope of having an economy. And there's a widespread belief that the economy is just going to snap back together. But I maintain when you get to the point of an overrun hospital, or a close relative of somebody finally dies, that people they want to think it's magical thinking, but they want to think that this is over, that it's all temporary, and it's not. And you can tell people all you want. I'm just thinking right now, just out loud, I had a sergeant once that looked at me really, really hard, and his face was red and his neck veins stood out like ropes. And he said, "England, some of them I just got to tell, and some of them just have to go pee on the electric fence for themselves. Now, which is going to be?" And right then, I really wished he thought that I was a good listener. But it's an element that you just have to keep repeating it, and finally the reality comes that other places are going back into lockdowns. They see that. They see the virus coming back after a lockdown. I know just out at the golf club, Beaupre, they just reissued the mask order in the clubhouse and made it much more strict. So, we're not going to be able to do it ourselves. It's going to be the reality occurs to people at different moments, probably when a relative gets sick and dies. You wish it didn't have to come to that, but that sergeant back then was right.
Reverend Barksdale?
Yeah, just to follow up to what Mayor Grinnell and Dr. England said, then does that imply the serious possibility that herd immunity will never be the answer, that we will never reach herd immunity?
If people can be reinfected and just get just as ill 3 or 4 months after they recovered, then it's a distinct possibility we won't get to herd immunity unless there's a vaccine. The vaccine would get you up to 65%, or you hope it would. So it's possible that this could go well longer than a year, and with all the consequences to our economy and
but
society.
Vaccine, herd immunity are different. A vaccine would be a yearly thing, and herd immunity was the hope that the antibodies would last. But according to what we've just discussed, if you can get it again, then the antibodies are not lasting.
A vaccine is one way to get yourself to herd immunity. So
Okay.
if you can get the population up to 65% immune using a vaccine, then you've achieved it without having to go through the constant wave of illnesses.
All right. Thank you.
Yeah.
Okay, are there other questions for Dr. England? If not, thank you so much, Dr. England, for your expertise.
Okay.
And on a personal note, as mayor, outgoing mayor of the city of Natchez, I really want to thank you. When I first formed this task force, you were there for the city, and thank you, and God bless you for all that you do for our community.
Thank you.